dental hygiene students from Loma Linda University, and today we're going to be talking about smoking and its harmful effects on your baby and your body, and also how to promote good oral health in your baby.
Before we go any further, I would like to know and raise a question that what do you expect out of your pregnancy?
A very common answer would be that you want a happy and healthy baby, right? Well, did you know that smoking, the things you snack on, how you take care of your teeth, that can actually make a big impact on your baby?
Before we get going, let's test your knowledge. True or false? Smoking while you're pregnant does not affect your pregnancy.
The answer is false. The next question is, nicotine can transfer through your body to your baby.
True.
True or false? Your cavities are genetic and contagious.
True. When you drop a binky, it's okay to pick it up and lick it.
That is false. I don't need to brush my baby's teeth because they're gonna fall out anyway.
No.
If you didn't get all the answers, stay tuned, because by the end of this video, you're gonna get another quiz where you can test your knowledge again.
First, we're gonna talk about smoking and the effects it can have on your baby. One of the biggest effects that it can have on your baby is that it can cause many birth defects, such as cleft lip or palate, sudden infant death syndrome, premature birth, miscarriages, low birth weight, harm to your child's tooth development, and missing teeth.
According to the CDC, 6% of clefts of the lip or palate in the US is caused by smoking during early pregnancy. Did you know that in the US alone, over 400 babies could be born without clefts if women did not smoke early in the pregnancy? Smoking can also cause neurological trauma, as well as weaken your child's immune system. Prenatal smoking can have many behavioral problems such as aggression and hyperactivity, affect their IQ, language skills, and motor capabilities. And they can also have an effect on your baby's immune system, leaving them susceptible for more risks of disease throughout life.
Tobacco can have very devastating effects on your pregnancy. You can have a stillbirth, birth defects, premature birth, stillbirth, and low birth weight. And it also increases the chance the baby have weak lungs.
No amount of tobacco is safe.
But you can prevent all of this.
Since Myrah said no amount of tobacco is safe or okay, there are some things you can do. According to the CDC, the best thing and the only way that you can prevent this is by quitting smoking. We have a great tip that you can do at home, which you can start, and that is to change your habit. You can have a calendar of the month and check off when you successfully went a day not smoking. And this can just help you keep accountable of your new goal. It's gonna be hard, you can mess up a few days because that's how it is when you change a habit, but as you keep going, give yourself about 3 weeks, it should get a little easier changing that habit.
Mothers who have a lot of caries can actually make it more susceptible for their children to have caries. And did you know that you can actually transfer the caries to your children by sharing saliva? Because of this, it's very important not to lick the baby's binky, share a silverware or spoon or something, or brush your baby's teeth with the same brush you use.
Other things you can do to prevent your baby from having cavities is that make sure your baby doesn't go to sleep with a bottle full of milk or juice. Instead, you can send your baby to sleep with a bottle of water in. Because what happens when your baby sleeps with a liquid aside from water is this: their baby's teeth can have decay, and it starts progressively getting worse and worse and worse, and their mouth will start to decay. Taking good care of your baby's teeth may not seem like a big deal right now because they're gonna fall out anyways, right? Not really, because if they fall out too soon, then it's gonna affect their adult teeth that are gonna come in later, and having caries that early will affect their overall health anyways.
Another crucial part of the overall health of your baby is to take care of their oral health. One of the ways you can do that is by, before even their first tooth erupts, you can build a habit to wipe their gums with a wet gauze or a wet towel, and make sure that you take them to their first dental visit even right after their first tooth emerges.
Start brushing the baby's teeth as soon as the first tooth arrives, or by their first birthday, and don't use fluoride toothpaste until the baby can spit. So use a thin smear of toothpaste for children under 3, and use about a pea size for children 3 to 6 years old. So I'm going to show you now. There's a smear. And there's a pea.
As your child gets older and as they're able to chew more solid foods, it's really important to keep track of what they're eating. When we eat really acidic foods and really sugary things, they tend to set on our teeth and actually help the bacteria to feed on that, so their teeth starts to decay a lot easier, even more so. So it's really important that we don't snack on things like that, like cookies, chips, Cheetos. And instead, snack on foods that are high in arginine. Arginine really helps your teeth build up instead of break down. So let me tell you a few examples. You can snack on cheese, nuts, turkey, chickpeas, lentils, soybeans, spirulina, pumpkin seeds. These are just a few examples of foods that are high in arginine that you can keep track of for your kids to snack on.
To summarize, remember, no amount of tobacco is safe for you or your baby's health. Remember, when you put them to bed, make sure they go to bed with a bottle with water instead of milk. To make sure you don't share saliva with like a spoon while feeding them, or on a toothbrush. Make sure you have them visit the dentist right after the eruption of their first tooth. And you build up good oral habits from a very early age. Make sure their nutrition is on point and they're not snacking on chips. And they're having a good nutritious meal.
To finish off, we're going to have another quiz to see how much you learned. When you drop a binky, it's okay to pick it up and lick it to clean it.
False. Remember that when you do lick it and to clean it, you're actually transferring your germs from your mouth to your baby's. So instead, what can you do? Rinse it out with water, make sure that you're rubbing it with your hands, and then it's safe to give to your baby. Toothpaste with fluoride can be given to children after they can spit.
True. You want them to be able to spit and not swallow the fluoride. Smoking while you're pregnant does not affect your baby.
That is false. As we learned earlier, it can cause many birth defects and neurological problems. Can you give one example of a good snack that is high in arginine and good for your teeth?
Did you think about the following foods? There's pumpkin seeds, soybeans, turkeys, cheese, nuts, and lentils. So if you got any one of those, good job. True or false? Smoking can affect your child's IQ level and language skills.
True, because tobacco can have such effects on your baby. Your cavities are contagious and genetic.
This is true. As we learned earlier, cavities can actually be transferred through your saliva, and if you have bad oral health, you can actually transfer that to your baby. True or false? Nicotine can pass through your body to your baby.
True, because it can go through the placenta. And remember earlier we talked about defects and how it can affect the baby's development in utero, that's exactly how it affects the baby.
Thanks for tuning in.
I hope you learned a lot, and congrats and good luck on your baby. Bye!